Okay. So we have put the patient in supine position. So we have attached the mouth gag to the chest piece holder, and then we have tilted the head position down. So now you have to just unlock this unit. So this will make all the three joints mobile. And then you have to bring it to the comfortable position. Scope system 0 adult. So this is a rotatory knob. We just lock it. 0 adult. Stop it.
Okay, sir.
Gauze sister. சரி விட்டுருங்க, அதை எடுத்து யாராவது ஒருத்தர் வச்சுக்கோங்க. சரி ஸ்டார்ட் பண்ணுங்க.
Yes, sir.
For tonsillectomy, you use a standard 0-degree endoscope. Sister, come here. This. Okay, show this. So you put it. There is a screw mechanism with a a Teflon tip to protect the scope from getting damaged. You have to slide the endoscope like this, and then put it in place. Completely lock it. Attach the camera head. Bring the cable to the side, and also the light cable. And then once you have attached everything, you unlock this screw and also this mechanism, and then put it in place, then lock it in position. Okay, right, stop.